Good morning, guys. Ooh, we see the sun up this morning. That means we died at the hospital at 5 a.m. this morning. We're getting there at 6:30 a.m. This week is on trauma rotation. So I got a week of trauma. Now I start more surgeries next week. However, we can sit no surgeries this week, so you guys will hear about some of the surgeries that I do. But I'm about to go on the road because I don't know. Got my new scrubs. Well, I already had them. Had to go home and get some new scrubs. But yeah.
So it's rare to see an open appendix. But there was something called a Rocky Davis. That money clip us now that Nuna looks like. Whoa, upgrade her diamonds now her girlfriends are like.
Whoa. So this is week 2. Currently rotating in trauma. It's gonna be a pretty weird week for me, but I'll make the most out of it because as a student, all we do is sit in the library until we hear a page of the intercom and we rush down to provide assistance. But I'm getting some OR time in between those cases, in between trauma calls. Alright, tomorrow we have parathyroidectomy scheduled for 8 a.m. We'll sit in that. So we're here getting groceries. So my living situation, I really don't have much space, so I try to limit the amount of things that I grab. Good morning, guys. So today is Tuesday, August the 3rd. Like I told you guys, I'm on vascular service. No, I'm not on vascular shit. I'm on trauma service this week. So the good thing about trauma service, we don't start until 7. But I don't want to condition my body to wake up at 7 because next week I'll be back waking up at 5. So I'm still waking up at 5. Got here around 5:40. I really was going to read up on the patient. Well, I read up on him yesterday, but read up on the procedure that we were doing. But the case got pushed to 10. Did a little bit of review. But what you want to do really is review the anatomy, vascular, the nerves and stuff right before you go in the OR, so you can be fresh in your head because you're gonna get pimped. So we're just gonna do some YouTube and Anki until about 6:50ish, and then go to morning report, and then we'll go from there. So see you guys very soon. Finally got time to go and look up this surgery, parathyroidectomy. They got pushed from 8 to 10, which is good because I got to sit in for morning rounds. But afternoon rounds, I'm not going to make those because the surgery's scheduled for about 10 to 12, a 2-hour surgery with the chairman of surgery. That's the reason why I want to go, because I want to be an LOR. So we're going to go and prepare for that. Time for surgery 2. Thyroidectomy, lobectomy. Lunchtime. So it's officially nap time. Be back in an hour. I'll tell you about my cases.
I ran up a check, I might do it again. Enemies close, have me thinking they're friends. 10 toes down, I'll be free until the end. Crib outside the city, I don't feel safe in my.
So we waiting for rounds to start. A lot of really cool cases I gotta talk to you guys about. I haven't updated you about yesterday, but I will be back.
Peso, add it up. I'm just doing me, everything is on me. Oh, you matter what? Add it up. Bankroll, euro, peso, add it up.
Finally able to sit down and get some work done. It's about 5:30. Just doing a little bit of UWorld review on a block I did last night. I know I'm trying to review the same block the same day so I can like sleep on it and assimilate the knowledge. But I got sleep last night, so I'm doing UWorld and waiting for the morning report. So this is how the report is. Screen comes down. Everybody sits here. Communicate about it.
much. You only climb me, I put the ladders up. No fault, I done doubled up on the workload. I think I fell in love with the bankroll. Pray up, get money, then we lay low. Add it up, bankroll, euro, peso, add it up. I'm just doing me, everything is on me. Oh, you matter what? Add it up, bankroll, euro, peso, add it up. I'm just doing me, everything is on me. Oh, you matter what? Add it up. Told her if it's all me, everything is on me. Gon' back it up. Matter what? Told you I'ma do me. Why you hating on me?
Good morning, guys. So day 5 of trauma rotation. As again, we're in here getting ready for the morning sign out. We have, me and the other student has to look a patient up, present the morning rounds. I'm used to doing it. I've done it plenty of times. Shout out to the Scrub Cap. This is really cool. Like the Scrub Cap, I'll leave a link to it in the description. This is not a sponsored video, but today, hopefully, I can jump in on some cases. Haven't been able to do cases in the last few days because, like I told you, I'm on trauma. So I have to respond to different traumas, and also the other students from the other teams get priority to the cases. So haven't done any exciting cases. So right now I'm just about to do some reading, and yeah, we're going from there. So see you a little later. You already know. Rocking with the monster this morning. I'm gonna watch some, maybe some Sports Center. Not Sports Center. First things first, then do my Anki cards this morning. So about to hop into a lumpectomy. 57-year-old woman was accidentally found left breast mass, microcalcifications concerned with DCIS. So we're gonna take care of that for her. I had 2 back-to-back, one at 10 o'clock and one at 11:30. Last minute case, so I studied some. Got a general idea what's going on, but we'll see.
Work, you start telling lies. Thought you were down to ride, you weren't down to ride. Cause
Don't stay in here. Nowhere near here. Rest your chest is facing it. Patient, anesthesia, nurse. So we just finished a lumpectomy, left breast right out of quadrant. I'll tell you more about it in a few seconds. Cause these people gonna come out here and I ain't trying to get cash.
breaking bills, friends breaking off.
You definitely making up for us this week. This is my 3rd surgery back to back. One of my friends couldn't make it here due to trauma, so it's 2 of us on trauma. So when I'm on the floors, he's covering trauma, and vice versa. So I'm in the OR right now, so he's covering all the trauma. So we have one more lumpectomy. 17-year-old woman, microcalcifications on mammography. So yeah. So my attendant made me run to the staff room. Eat a piece of cake. I was at 4 surgeries back to back, 3 or 4. I don't know. So cake and apple juice. Then we're going to do another. Alright guys, we're finally done for today. Had 4 cases back to back. All lumpectomies. Worked with a really good doctor. Really nice. Helped me with a lot of stuff. And like I tell you guys, D. Virgilio's is goated when it comes to studying for surgery. People say the book is not good. I don't know what's going on. But if you've never seen D. Virgilio's, this book right here. Couple cases, places, had mammograms, so some microcalcifications. Other than that, told the patients had DCIS, ductal carcinoma in situ. This is what that is. One of them had atypical ductal hyperplasia. Took care of that. I'm going home.